Good morning.
Good
First,
morning.
I want to congratulate you on making your paper. Okay, so your study design, you stated that it's a cohort. Okay. What is the type of study? What do you mean by when you do a cohort? So, what is a cohort study?
A cohort study is depending on their sample size, depending on your patients, you have one group with, for my study, one group has the pain and the other group doesn't have the pain.
Okay. By definition, a cohort study design is a study design wherein you want to prove an association between two factors, between two variables, and then you have to establish the risk factors involved on it. So your paper lacks the establishing the risk factor part on why your patients had anxiety pre-op. Okay? So I would suggest you do also an analysis on the possible risk factors on why these patients have anxiety. Okay.
Noted.
Then the next question would be, you included different types of surgeries. So what type of bias were you introducing on your paper?
Actually, I'm not so sure with the bias, I guess.
You introduced selection bias on your paper because yes, you did include one of the inclusion would be the length of the incision. But
Incision.
do you think that would the results that you presented were misleading because you were doing different surgeries, and so the pain on a neuro patient is different from a GS and it's different from an orthopedic. So your conclusion is basically misleading.
Yes,
So
ma'am.
what could be, how could you solve that problem because you introduced selection bias?
Yes, ma'am. But also in my inclusion criteria, I also included that surgery, that length of the surgery, which is under 4 hours. So it must be under 4 hours. If it's not, I anticipate with the procedure or with the surgery, and I will not actually include it in the study.
The hours doesn't matter. It's the type of surgery. So better
Okay.
you can improve your paper, but just concentrating on one type of surgeries.
Okay.
So,
Noted, ma'am.
iisa lang yung type of, yung pain na you would be expecting from the patient.
Okay. Noted po.
Good morning. Well, I want to congratulate you with your paper presentation. But you know, I think, as Dr. Rab said, the pain, you should have stated there an association of pre-op anxiety with post-op pain control at 1 hour. It should be with pain or without pain. And there should be a total. Because sometimes, even if the patient is anxious, post-operatively, it depends upon your analgesic control, the patient will not have pain at all. So, you determine the association of the exposure with the outcome of computing for the relative risk, and it's 95% confidence level aside from the p-value. So, the table should be done for all time intervals.
Noted po.
Okay.
Noted, ma'am.
Okay. You have here a statement which says, the first anesthesiologist assessed the patient using HADS, after which the results were recorded and the patient were grouped accordingly as to anxiety versus no anxiety group.
Yes, ma'am.
But then you have here, hospital anxiety and depression scale is a self-assessment scale developed to detect states of depression, anxiety, and emotional distress among patients.
Yes.
So from where did you get the HAD score? From the patient? or as determined by the anesthesiologist?
From the patient, ma'am. Then the anesthesiologist will tabulate. Will total the scores. So the patient will answer
Okay.
the HADs, then the anesthesiologist will score.
Please make that statement
Noted.
or rephrase the statement to reflect what you have just told us.
Noted, ma'am.
Now, according to the type of surgery, given that there was selection bias, how did you address the patient's pain?
During when the patient were at the recovery room, they were monitored hourly. So we
No, I mean the how did you what are the post-op regimen or drugs that you gave?
we have a multimodal. So we have an NSAID, a paracetamol, and tramadol
For all patients.
for all patients. Then
So-
we record if there's a need for another dose of tramadol.
May I just know how you gave the different drugs? Do you give them together? Do you give them one after the other? How do you give them?
Usually, generally, the paracetamol and ketorolac was given after the surgery. Then the tramadol is at the recovery room. Usually, it starts at the recovery room.
And then how about the frequency?
It will depend on the patient. If the patient wants another dose, then we give. But actually, it's every 6 hours for the tramadol. Then, if the patient asks for another dose, then we give again.
How
another
about the
dose.
ketorolac and the
The ketorolac
paracetamol?
is every 6 hours, and the paracetamol is every 8 hours for that whole 24 hours.
So again, my reservation is regarding the case mix, no?
Noted, ma'am.
Okay.
Thank you, Dr. Lapitan. Next presenter is Dr. Brian Rainier Tijeradura on the topic, the predictive value of baseline pulse oximeter perfusion on the incidence of hypotension during balanced general anesthesia induction, a prospective observational study.